80% of pregnancy-related deaths in Washington were preventable. That's the recent finding from the 2023 State Maternal Mortality Report. Tonight we hear from an expert who says behavioral health issues and substance use were the leading causes of death for pregnant women. From 2014 to 2020, the Washington State Department of Health identified 224 women who died either while pregnant or within a year after pregnancy ended. A new report says 97 of those patients died from a pregnancy-related issue.
Something has to be done about that.
Deborah Gardner is the DOH's Maternal Mortality Review Coordinator.
The overarching vision of this is that any maternal death is unacceptable. And so ultimately, we hope to prevent them and improve the overall well-being of adults and children in Washington.
And what's causing these pregnant patients to die may not be what you suspect.
So the leading underlying causes of pregnancy-related deaths were behavioral health conditions, predominantly by suicide and overdose. And also we're looking at deaths through hemorrhage and infection.
Gardner says it's important to include up to a year postpartum and hopes this report will encourage providers to extend care beyond that 6-week checkup.
With behavioral health, for example, nearly 2/3 of deaths due to unintentional substance overdose happened later in postpartum.
The report also found the risk of dying during pregnancy goes up for pregnant patients of color, or if you live in a more rural area. Think of the Toppenish Labor and Delivery Center that had to close, leaving families with options for care few and far between.
We're seeing situations where stressors from things like systemic racism or being low income can actually worsen somebody's risk for mood disorders during and after pregnancy, but also limit whether they get screening and care.
While a lot is already being done in Washington to ensure preventable pregnancy-related deaths stay at zero, the report also has recommendations for lawmakers and providers. Gardner says people in affected communities have the power to enact change.
Black and Indigenous and communities of people of color must be centered as leaders for the successful implementation of many of the recommendations in the report. I hope it really makes a difference. I think people are very passionate about this.
If you or someone you know is suffering with a pregnancy or postpartum related mood disorder, help is available at the number below. We'll have a link to that full report on our website, yaktraynews.com.